All right, committee, welcome back to our noon meeting. Since we carried over House Bill 143, we had just got done listening to Forta. We're up to, well, I guess we're going to be here for an hour. Anyone, let me pull up the Zoom as well, which hasn't quite worked yet today because we've had some technology issues, as many of you are familiar, kind of all day plaguing the Capitol. But with that, anyone else in the audience? Representative Olson, anything? Let's start maybe with the department, since they're here. Department of Health or Medicaid. If we're on the same page on, well, if you're all on the same page, and Health and Medicaid, come on down. Welcome to Labor and Health. Floor is yours. We're on House Bill 143. Any comments you wish to provide, Mr. Fuchs?
Thank you, Mr. Chairman. Mr. Chairman, members of the committee, my name is Franz Fuchs. I'm a policy analyst with the Department of Health. I'm joined here with Lee Grossman, our state Medicaid agent, and Jesse Springer, our deputy state or HCF administrator. Is that the new title? Okay, so we just wanted to provide a little background, start with a little background on treatment Medicaid coverage of autism spectrum disorders and ABA specifically, and then talk to the bill, if that's okay. Just some background. Medicaid has been required to cover autism spectrum disorder treatment since 2014, and all states in the union cover autism spectrum disorder treatment through what's called the EPSDT, or Early Prevention, Screening, Detection, and Treatment benefit. So this is a very open-ended benefit for children that has been in the books since the 50s. It's in our statute under 42.4.103, Romanet 10. And so that is the statutory authority we have to provide autism spectrum disorder treatment services as required. Applied behavioral analysis, or ABA, is one treatment modality for ASD. So there's a host of other treatment options in Medicaid, ranging from behavioral health to the IDD, the waivers, to early intervention preschools, to school-based services. There's a whole host of other professionals that can provide services that might help. But we do cover ABA under Medicaid. Just some facts and figures. There are currently 1,514 kids with an autism diagnosis in the state that are on Medicaid. Of those, 50 have received ABA services in the last 2 years. We have 7 enrolled providers that bill, and they employ 252 providers that treat. So the treating providers work for, usually a practice, right, that bills the Medicaid. So those are the numbers of billing providers and treating providers. And we expend approximately $1.5 million per year on ABA services. So when you divide the total expenditures by the total number of people, that works out to about $25,000 per person treated per year for ABA, just for ABA. That's not including of all the other services they may receive.
And that's just ABA for minors?
Correct.
Okay. And that's anywhere from 2 to 18, until they
Chairman, that's correct. Until
Thanks.
21 is the EPSDT benefit. So that's just some background on ASD and ABA in Wyoming specifically. Regarding this bill, the department, we did not receive a request for a fiscal note. There is no appropriation in this bill. So it is our understanding that the legislative intent here is for Medicaid to not cover this new provider group of these family members who are enrolled as under supervision technicians. So we just want to make that clear that as this bill proceeds, if it passes, Medicaid will not cover these new providers and will not pay for these new providers. If that's not what the legislature intends, we need an appropriation to cover the cost of those services. And so just ballpark, say 250 to 500 children now receive these services, right? We're going from 50 to 250 to 500, which is, I think, a reasonable middle ground, right? To up to the 1,500 kids that may have autism spectrum diagnoses in the state. That would pencil out to around $11 million appropriation that we'd require. So if it is the intent of the legislature to have Medicaid cover these services, that's the amount we'd recommend to appropriate. And with that, we'd happy to stand for any questions or concerns or comments.
Oh, well, I guess the concern comment is there a fiscal note on the bill, Barb? Do you have it in your possession? Or was the department asked to provide a fiscal note on this piece of legislation?
Mr. Chairman, we were not.
perhaps just a bit more information on why it would cost, and that's a $11 million state fund plus an $11 million federal match when it comes to these type of services, and why would you need an additional appropriation? If we did it without giving you an appropriation, what would happen?
Mr. Chairman, that would be an $11 million state general fund plus $11 million federal fund on a biennial basis. So given that it's a budget bill or a budget session, and for a biennium, it'd be 22 total, 11 for the year, split 50-50. The reason we just generally cannot eat a dollar figure of that magnitude. You know, if this was $50,000, $20,000, that's something Medicaid could probably absorb. But it's been a decade since Medicaid has come to the legislature with a budget overage, and we take our fiduciary responsibility to the taxpayer very seriously. And we ask that any added services be funded.
And maybe this is an inappropriate question, but can you extrapolate based on other services the number of ABA services provided to kids on Medicaid versus what may be across the spectrum in Wyoming? I mean, we had a figure this morning that somewhere between 3,500 and 5,000 kids are somewhere perhaps on the spectrum. What proportion of them do you think Medicaid has on ABA services versus what private pay would have, if you could make that generalization broadly?
So, Mr. Chairman, a very small number of Medicaid kids do receive ABA right now, so that's 50. But there are 1,500 kids with an autism spectrum diagnosis, so I'd say half to a third of the total children, just based on the number you put out there, would be on Medicaid. And we're just basing that rough ballpark estimate. Again, we weren't asked for a fiscal note, so this is kind of actuarial math on the back of a napkin estimate based on, you know, a likely lower rate for the new provider type because they're under supervision of the licensed providers, and a ballpark number of kids, which again, we don't know what the take-up will be. But for 250 kids, around, you know, $10 to $11 million a year.
Besides that number being thrown out there in a committee hearing, other thoughts on the bill of the department billing correctly, making it work? If we were to throw an $11 million appropriation in the bill, you could still immediately start implementing, you know, with the effective date of this act?
Chairman Zwanitzer, so just to be clear, we weren't sent the bill because the licensing statutes don't automatically equate to Medicaid coverage. So there's a lot of things in licensing statute that Medicaid does not cover. So there's other positions, other medical professions that are not covered by Medicaid currently, you know, and then the legislature periodically revisits those, like chiropractic or podiatry last year, and says, yes, we actually do want to cover that under Medicaid. So that, you know, that's the case here. So if you added it to licensing, it doesn't automatically translate to Medicaid coverage. But to your specific question, Chairman Zwanitzer, to cover parents specifically, you know, in the model that was presented, generally when we have paid parents, it's been under a home income-based waiver, and we actually pay the parents directly, or we pay the family members directly. We don't pay them through a pass-through. So there are some issues with the pass-through model that was discussed earlier in terms of we're paying a provider and then they're paying a client because, you know, so there's just kickback provisions that we're subject to under federal law as Medicaid. So generally we pay the parents when we do want to pay the parent or a family member, grandparent, whoever. Generally they're enrolling with us directly under self-directed care in some cases, and we're paying them as a provider directly. So the billing provider is actually the parent. So if this did want to be covered under Medicaid, we would need to pursue the waiver option likely so that we could pay the parents directly. The idea that a provider is going to do a pass-through and pay a client, I think would have a lot of issues. And we don't have any other model or service that works that way, to my knowledge.
So it would require like an amendment in the state plan or rules making, or it would just be a one-off I guess, is there more internal work you'd have to do to certify, and what does that look like? Mr. Grossman, welcome.
Yeah, Mr. Chairman, Lee Grossman, State Medicaid Agent with the Wyoming Department of Health. I think what you heard from Mr. Springer were just some initial thoughts, as we're, excuse me, as we're educating ourselves on this model and this bill. I think the main takeaway is that this would be, really a new sort of way that we would be trying to pay family members for providing Medicaid services. So be it waiver or other authorities, we'd have to likely get creative, again, if that were the direction of the legislature. But back to Mr. Fuchs' prior point, if the bill proceeds as is, I just want to reiterate that our interpretation, especially given the lack of an appropriation, is that Medicaid would not be covering this provider type. So if nothing changes in terms of the legislative direction that's currently in the bill, that's how we would proceed forward. Essentially, no changes in terms of the Medicaid program. But again, in terms of why you've got the three of us up here, we just want to make sure that we're all very clear in terms of informing you what the approach would be.
Thank you, Mr. Chairman. Of the 50 children you're presently taking care of, 1.5 million, how is that running right now? What system is that running through?
Mr. Grossman.
So we're paying those providers, they're just under the normal behavioral health limit. So we have a limit or a threshold of 30 visits, 30 dates of service a year before you require prior authorization. And then those services go through prior authorization if the child needs more than 30 dates of service, which I would assume approval rate's pretty good. And then that's just part of the plan of care to say, they get that prior authorization, they submit a claim to our claim system, and we pay those claims. So it's it doesn't have really some of the same logistics. For us, it's just another type of mental health provider, another type of provider. So it's very similar to all the other services we have. A parent provider just has some extra considerations we would need to work through.
Yep, follow up.
So when you're taking the 3 to 250 to 500 and you're figuring that $2,500 or $25,000 per, that might not be a crossover or the same amount of money? That makes sense?
That makes sense to you, Mr. Fuchs?
So, Mr. Chairman, Representative Ahern, the 25,000, we wouldn't necessarily assume that amount exactly because this provider type would likely have a lower reimbursement rate since they are under supervision of a licensed provider. But again, not knowing what the rate would be per se and the uptake and the utilization, that's a real ballpark estimate of 11 million. It wouldn't necessarily do the math on 25,000 exactly.
Further questions to the Department of Health or Medicaid? Seeing none. I'd like to say thanks for being here, but thanks for being here. We appreciate your testimony and comments and analysis. I think I have my Zoom working. So let me just bring in, actually, if you could make me a host again, Barbara Pierre. Or if you just want to bring in all 4 attendees, that would also be perfectly acceptable. Any other agencies here? Hi, agency, come on up. Board and commission. I'm picking which board, but I'm sure you could introduce yourself, Joanne. Welcome, Ms. Reed.
Thank you, Mr. Chairman, members of the committee. I am Joanne Reed. I am the Executive Director for the Board of Psychology. Just fill in a couple of little questions I think I heard this morning. Legislation for regulation of behavior analysts was passed in 2022, and they were put under the Board of Psychology. The first behavior analyst was licensed in March of 2023, and there's currently 47 behavior analysts licensed in Wyoming, with only 25 of those giving a Wyoming address. So the remainder would be out of state. The statute requires that behavior analysts and assistant behavior analysts hold a current certification as a board certified behavior analyst or board certified assistant behavior analyst from the certifying entity in order to be licensed in Wyoming. And the board by rule recognizes the Behavior Analyst Certification Board as the sole certifying entity recognized by the board. So I'm not sure if that clarifies a couple of the questions I heard about. There is a licensing requirement, but there is also a national behavior analyst certification required in order for them to be licensed in Wyoming.
And you have to achieve both, or does one
Yeah.
substitute for the other?
You have to keep both.
Keep both. And then do we have any reciprocity agreements with other states in this area?
The reciprocity is basically the BACB
Okay.
credential, because that's pretty much universal across all of the states that are currently licensing behavior analysts.
But really, the first one just got licensed less than a year ago? Is that your testimony, 2023, Mark?
Yes, legislation passed in 2022. Once the rules were written, we started issuing in March of 23.
I guess it's fair to ask, any initial complaints to the board, investigations, anything in that area in the first year? Yeah.
Knock on wood, we have not received any complaints as of yet.
Okay. All right, Representative Clouston.
Thank you, Mr. Chairman. Thank you for being here. So we just started this, and now can you tell me the total number that we have licensed right now in Wyoming? Was that
Mr.
what?
Chairman, Representative Clouston, you mean behavior analysts? Yes, we have 47 behavior analysts licensed with one assistant behavior analyst.
Seeing none. Thanks for coming in on your lunch hour. With that, people online, I see Mr. Hackman has his hand up. No other agencies. Okay. Mr. Hackman, the floor is yours if you want it, and then we'll go to Ms. Delancey.
Good morning or good afternoon, Mr. Chairman. I hope you all can see me. I
We can hear you,
don't.
we cannot see you.
Okay, let me see if I can. Okay, I think I've got it. Okay, I got it.
You got it.
Thank you, Mr. Chairman. Yeah, I'll be brief. I'm a psychologist, Hollis Hackman, representing the Wyoming Psychological Association. I'm their legislative chair, and I'm their federal advocacy coordinator. We have a lot of concerns about this bill. We appreciate the bringer, Chairman Olson, bringing this bill. It helps highlight the need for mental health services in our state, which we're short of pretty well across the board. But our concerns are primarily in and around the issue of ethics. As a psychologist, and you heard this predicted by Chairman Olson earlier, but as a psychologist, I can't treat my children. I can't treat family members. It's not ethical. It's what we call a dual relationship. And so kind of from a 30,000-foot level, psychologists really can't do that. We put our license at risk. But it also then extends to people that we supervise. If we delegate work to others, then we're responsible for them complying with our ethical guidelines. So if we're supervising other people, they can't really have a dual relationship either, or we can run afoul of our own ethics code. So that's our primary concern. I know that we've got one of our behavior analysts on the line. I'm going to let him talk in more detail about some of their concerns, but and just to amplify what Joanne just shared with you, we just got our behavior analysts under the umbrella of the Psychology Practice Act in the last budget session, and that was partly at the behest of the state, who was employing behavior analysts but couldn't remunerate them properly because they weren't really able to categorize them because they weren't under anybody's jurisdiction. So now they're under our jurisdiction, and that's new for our board, as you just heard. And then in the last session, Mr. Chairman, we also passed a bill for us joining an interjurisdictional compact, which includes 40 other states now. And so our board, although Joanne didn't necessarily speak to this, they've been under quite a bit of pressure to adjust to these changes. So we have concerns along those lines as well. And I'll just wrap up by again thanking Chairman Olson for bringing the bill and highlighting the shortages that we have in the state. And we would just suggest that Perhaps an alternative here is to expand training opportunities through our Department of Health and make some arrangements so we can get some more qualified people on board to help folks in need. And with that, I would be happy to stand for any questions.
Questions for Mr. Hackman on behalf of the Board of Psychology? Seeing none. Thank you for being here, Hollis. Ms. Delancey will be up next, then we'll go to Mr. Dickey after that. Cindy, if you're with us, the floor is yours.
Thank you, Mr. Chairman, members of the committee. Thank you very much for allowing me to appear remotely today as well. I know that there's others that want to speak, so I'll keep my time briefly, but I'm just testifying, Mr. Chairman, Cindy Delancey, in my individual capacity. And really why I felt compelled to weigh in on this bill is I'm a parent of an autistic child that ABA therapy was not available to me when my son could have desperately needed it. He's now 18 and he's an adult. And much like the testimony we heard this morning from Ms. Davis, there's oftentimes that I wonder what if I could have had the opportunity to have this therapy for him when the window is open. We are in crisis right now. Everyone in the room probably knows someone or has a friend that has somebody that has some connection to the autism community. And as a parent that's not on Medicaid, that's not looking to receive any kind of, state assistance for payment through Medicaid, I kind of really want to bring that population forward. I was told by my insurance company that this wasn't covered. I was also told that this wasn't available in Wyoming when I looked into this many, many years ago when my son was young. I'm happy to hear that services have expanded over the years, but I didn't want to move to Colorado. I didn't want to move to Utah. I wanted to live right here in Wyoming. And in fact, I moved from Saratoga when I found out that my child had autism to Cheyenne, thinking that resources would be available. And not much, unfortunately, has changed, in the 13 years that we've been trying to, have Bo in therapy. I really, really ask, to please keep this bill moving for those of us that, again, are not seeking Medicaid reimbursement, and to just, hear heavy-handed regulation of all the reasons why we can't do something, as opposed to empowering parents who know their child and their child's needs best to figure out a way that we can. Chairman Olson and the folks that you heard this morning have a high degree of expertise. So if this wasn't possible, I just find it, pretty unrealistic that they wouldn't be bringing this concept forward for us to be able to meet the needs of Wyoming citizens in Wyoming with Wyoming people. So, it's just, yes, it's new. Yes, there might be some outside the box thought process or creativity or, a fresh look, but this is really a great tool for parents to be able to take care of their own children, to get certified, to learn the ropes. I mean, I would have done anything in my power had I had something as wonderful as this accessible to me to help my son at a time where it really could have made a difference for him. I feel that this is absolutely doable and, really a great way for us to be able to come up with a solution. Because right now, as we remain in crisis of meeting the needs of such a very needy population in our state, we don't have many options available to us as parents. So again, I deeply, strongly ask for your support on this bill, House Bill 143, and to keep this discussion moving and not just let, maybe, governmental concerns or fears or because it's new stand in the way of really being able to allow parents to deliver care that they desperately want to deliver to their children. So thank you, Mr. Chairman, and I'm happy to answer any questions from the committee.
Thank you, Mr. Lancey. Any questions from the committee for Cindy? Seeing none, but thank you for joining us remotely.
Thank you, Mr. Chairman.
Next up, Mr. Dickey, and then we'll go to Ms. El Sangioni.
Mr. Chairman and members of the committee, thank you for giving me the opportunity to share my thoughts this afternoon. My name is Brad Dickey. I serve on the Wyoming Board of Psychology. I'm also here today representing myself as a licensed behavior analyst in Wyoming. For some background, I was the second board certified behavior analyst to practice in our state. I also have about 20 years of experience within this field, and I've actively participated in crafting Behavior Analyst Licensure Act for our state to provide this service. I share your goal of expansion and trying to increase access to services for families that have children diagnosed with autism. I also believe that it's a top priority. I commend your dedication to finding effective solutions, but I have a lot of concerns about this proposed bill and believe that alternative approaches would provide more benefits with fewer harms. I oppose this bill for several significant reasons. I'd like to outline those reasons along with some potential solutions that I believe deserve your consideration. This bill poses several concerns. It allows parents to serve as technicians for their own children, which would violate the current licensure law in our ethics code. A key ethical standard that this model violates is the prohibition against multiple relationships. This is kind of what Dr. Hackman had talked about. And there's a lot of conflicts of interest between the technician and the supervising behavior analyst. Having parents be a behavioral technician for their own children would place them in a conflicted dual relationship. Since Wyoming licensure law requires licensed behavior analysts to supervise technicians and other paraprofessionals that deliver these services, the licensed behavior analyst who participates in this model would be at risk of losing their license right now. If a parent were a technician and they were a registered behavioral technician credentialed through the National Behavior Analyst Licensure Board, they would also be violating the ethics code and they would be at risk of losing their credentials as well. This is outlined in the July 2022 issue of the newsletter. When providing effective treatment, there really needs to be independent judgment and objectivity to provide effective services. And this would all be compromised through this new bill. There also needs to be specialized training and expertise to deliver quality evidence-based services. This would potentially jeopardize the quality of care and impact the outcomes for children. There's also a lot of concerns around providing supervision and training. So for example, if a parent technician were to secure and pay a licensed behavior analyst supervisor or a behavioral technician to supervise them, this would create a multiple relationship and a lot of conflicts of interest for both parties. I understand that the intent of this bill is to help alleviate staffing shortages and increase access to ABA services, but I would argue that this is misleading. Even if a licensed behavior analyst were to participate in this model, the supervising parent behavioral technician would be violating licensure law and our ethical standards. The services would be severely compromised for all the reasons I've outlined. Additionally, the licensed behavior analyst would face serious practical challenges. For example, it would be difficult for the licensed behavior analyst who is responsible for the child's treatment plan to ensure consistent and accurate implementation of a plan if the parent refused to accept supervision as required by law, or they prioritize their own wishes over the convenience of what they feel like is best. In most circumstances, the licensed behavior analyst has the right and the responsibility to require the behavioral technician to undergo additional training, or they would even fire the technician. But under this new law, that would be extremely difficult to do with a parent behavioral technician. Other potential problems include parent techs being able to provide services or not being able to provide services or receive supervision when needed because of other parental obligations. Or what would you do if a parent decided that they wanted to take on this role, realized it was too much, and then stopped? This would leave the child without services. Lastly, I've spoken with numerous licensed behavior analysts across Wyoming, and so far there is unanimous opposition to this bill. All the licensed behavior analysts share ethical and practical concerns that I've outlined here today. We respectfully ask you not to proceed with this bill, that it directly contradicts licensure law and ethical standards. Please consider some potential other strategies for building our state's capacity to serve its citizens. Some of the possibilities are expansion of telehealth services. Currently, some healthcare plans do not authorize the delivery of ABA therapy services through telehealth. I would encourage that we expand telehealth expansion delivery to increase access to ABA services overseen by a licensed behavior analyst for individuals diagnosed with autism, especially for more remote areas. I would also encourage you to invest in expanding training programs. This could include funded initiatives at the university or allow providers to learn how to train more behavioral technicians. Right now, to my awareness, there's no programs within our state that allow professionals to become licensed as a behavior analyst, and I don't think there's anything available at the University of Wyoming. This has been a long concern of mine right now, that there's no training right now within our state to help increase the expansion and delivery of ABA services. So in conclusion, this issue holds a lot of personal significance to me and my colleagues across the state. As a licensed behavior analyst, I've seen firsthand the struggles that families face in accessing quality ABA therapy. And while my colleagues and I share the goal of expanding access to services, we collectively oppose this bill due to the potential problems with reducing the quality of services, undermining our ethical standards in our licensure law, and putting consumers at risk. I'm happy to answer any other questions.
Thank you for your testimony. One quick one for you. We heard a lot this morning that telehealth is not really the best medium of exchange for these type of ABA services, but then you said that might be a better expanding those for coverage and care. So just thoughts on, is telehealth beneficial or workable for this population?
Right now, I've done telehealth in the past. I know people that use telehealth throughout the state. I would be curious how they would provide services without telehealth. I would assume that a lot of the people who are going to be overseeing and supervising these services do not live in Wyoming, and the only way for them to work with these families is through telehealth.
Okay, Representative Yin, question?
Mr. Chairman, thank you. So I think from your testimony, you basically said that the board that creates the certification for behavior analysts would essentially revoke your certification if they found out that you were overseeing a parent who was a behavioral technician. Is that correct? Is that a good summary of what you said? Okay.
That's correct. Yep. So we are held to pretty strict ethical guidelines around what we can and can't do. If we were to violate that ethical code, then we would basically revoke the license because they're not practicing according to the code.
So, Mr. Chairman, I'm looking at the requirements for licensure that we had passed in 22. They have to have that board certification to hold a license. So even if we pass this bill and then someone found out that a behavioral analyst was doing this with a parent, and then they lost their certification and then they lost their license, I think in the end would end up still removing a behavioral analyst from being able to practice in Wyoming, plus not being able to do what the statute requires, which is have a behavioral analyst oversee the parent. So I think, I guess the question, Mr. Chairman, is there a way to salvage this bill as is, or do you think that if we pass this bill, it still wouldn't work to actually expand the population that could be helped?
Mr. Dickey.
My thought is to use the model that we currently have. We have a brand new licensure act that we just started to license behavior analysts under. We're in the process of training new technicians in the state. This came forward because of the need, and listening to the other parents is hard for me to hear because I understand the need, but I don't feel like this is a good solution. I really strongly feel that we need to invest in more training programs.
They can't.
And another option that I know people don't like talking about is increasing the reimbursement rate to get people to move to the state to provide these services to help retain staff. So that's another option too, is, we need to motivate people to move here to provide these services. And we also need to increase training programs to allow people to have the credentials to provide these services.
Any further questions for Mr. Dickey? Seeing none, thank you for being here, Brad.
Thank you.
Up, Ms. Elson-Juni. Miriam, the floor is yours.
Hi, thank you, Mr. Chairman. My name is Miriam Elson-Juni, and I'm the mother to beautiful twin boys who live with autism. Today, I testify as a mother and on behalf of families like mine who face the same heartbreaking challenges as we have, waiting for our children to receive life-changing ABA therapy. When my boys were first diagnosed, after much research and talking to multiple doctors, we knew we were going to seek ABA therapy for our boys to help give them the best possible outcome with their diagnosis. We have been on numerous waitlists for multiple ABA clinics from early diagnosis up until I found Forta. My family had made the decision to move cross-country in 2022, and my first goal was to find an ABA provider to work with my boys. At that time, my boys were put on waiting lists. When I found Forta in 2022, I filled out all the necessary information and was contacted by Forta immediately. When I learned about Forta and the opportunity to do their 50-hour behavior technician ABA course, I was confident that that could be a great fit for our family. This model allowed for an opportunity to access therapy for my boys, to provide a continuum of care that unfortunately was failing us at previous clinics our boys have attended, as staff turnover was high and quality therapy was lacking. I'd like to make note that today in 2024, my boys are still on those previous waiting lists from 2022. Fortunately, with access to Forta's parent-led model, I've been able to provide life-changing therapy to both my boys. I'm able to work with the BCBA weekly, who provides training, support, and supervision to ensure the quality of care and therapy my boys receive is effective and impactful. If we didn't have this opportunity with Forta, my boys would have lost out on over a year of therapy and be further behind developmentally than they already are. The parent-led Forta model has empowered me to not only make a difference in my children's lives, but has been impactful to our entire family in numerous ways. Through therapy goals, my boys have made significant growth. Some important to note are they're now able to sit at family meals. They can independently use words to ask us to play with us and functionally communicate their wants and needs, including independently asking for hugs, something that we've yearned for years. These may all seem like small things, but significantly impact families like mine on a daily basis. And I truly owe Forta's parent-led model to bridging the gap and helping my children make leaps in growth in the areas they have had the most deficits in because of living with autism. Two other things I wasn't going to mention, but hearing all the other testimony, I've heard telehealth mentioned multiple times, and that's something my children could never do with ABA because I'd have to sit beside them essentially and be doing what I'm doing with Forta now, but not being paid for it. They would never sit in front of a computer and receive the therapy that I'm implementing because it would just be near impossible for that to happen. So telehealth would not be an option for my family, and I know many other families it wouldn't be when it comes to receiving ABA. The second thing I wanted to touch upon was Medicaid. We use private insurance, but I have a lot of friends that use Medicaid. And one of the things, I know the numbers look like a lot right now, but our kids are going to grow up to be adults and they're going to be growing up and they need to be functioning, and ABA helps them function in a way that makes them independent. So I would not look at those numbers and be scared, because spend the money now and not worry about having a bunch of adults that have nowhere to go and aren't functioning. So that's just something else I want to add. But thank you, Mr. Chairman and representatives for allowing me to speak. And if you had any questions about my family's experience, I'm open to them.
Thank you so much, Ms. Elsanduni. Any questions from the committee? Representative Yun.
Thank you, Mr. Chairman. I apologize if I'm butchering your name, Ms. Elsanduni.
No problem.
So it sounds like you already are working under Forta's model. Is that correct?
Yes.
So is that under our current Wyoming law, or is that somewhere else? How is, I want to understand how this model works.
So I'm in Connecticut.
Okay.
And I got the training. I did the 50-hour course and received all the training, and I follow all the guidelines. Like, we receive supervision every week. A BCBA does the evaluation. The boys are constant. There's data that's taken. There's nothing different that's happening with this model than when my boys were in a clinic, except we have access to care. Previously, we've been on wait lists for years and years. And then when we have gone to clinics, the turnover and staff rate is so high that my kids don't actually benefit from the therapy. So this model has been really beneficial to my family. And I have 5 kids, 2 that are special needs, and I've been able to make this model work for our family because my boys need this therapy, and it was the only way for me to provide it for them.
And just to thank you, Mr. Chairman, just to confirm, you're being overseen by a board certified behavior analyst. I think that's what you stated.
Yes, I am being seen. I meet with her weekly. I have supervision with her weekly, follow all the guidelines that are recommended and necessary, or else insurance wouldn't pay for it if we weren't hitting all those guidelines. And there's nothing really different than the delivery of the ABA, except I'm able to access it for my family now through this model.
Okay, thank you.
Any further questions? Seeing none, thank you for zooming in with us past lunch your time, but lunch hour our time.
Thanks.
I think that's our last person online, so yeah. comment from the gallery. Welcome, Ms. Defoe. Floor is yours.
Right, thank you, Mr. Chairman, members of the committee. I'm Jessie Defoe. I'm here with Forta today, and I also have a behavioral analysis that I'll have her introduce herself in a moment. But just to answer some questions and to follow up some of the things you've heard, we appreciate hearing concerns and thoughts about it and other solutions that might be possible, but a lot of those have created long timelines and no immediate relief for parents who are looking for it. And so what we're here today is to talk about a parental empowerment option that offers students or offers all the children relief right now. And so that's what we're looking at. Two things to think about as we continue this discussion is, first of all, the Medicaid discussion. We don't think there needs to be a fiscal note right now. The question isn't who's going to pay for it, rather a policy decision and talking about the ambiguity in the law right now and if a parent is qualified to provide this or not through this model. So I think that that's a discussion for a later day that should continue, and we're very amenable to that discussion and continuing it, but that shouldn't affect the policy decision in front of you today.
Hi, welcome. Introduce yourself to the committee.
Sorry, making sure the microphone's on. Mr. Chairman, members of the committee, I wanted to introduce yourself. I'm here as a mother of an autistic son. I'm also a board behavior analyst, and
we just need your name.
Jody Rumpf, sorry.
Jody Rumpf, thank you.
Let me breathe.
We're not very intimidating. We're pretty friendly. So,
Oh,
yeah, take a breath.
you're a little
It's,
scary from down here, but I'll be okay.
All right, go ahead.
So my journey with autism started, I lived very remote. We hauled water, we had a generator for electricity, and we lived very remote, and my 2-year-old was diagnosed with autism. And I had never heard of autism before. And I went online and I cried. I saw stories of 30-year-olds who weren't potty trained and that he would never be independent, and he was nonverbal. Every time we turned on the vacuum, he would have a 2-hour tantrum. And we stopped using the vacuum. We would actually brush our rugs, and because it was just not worth it. And he engaged in self-injury to the point that he would draw blood. And I was hopeless and helpless, and I did not have the tools to help my own child. And as a parent, that is the worst feeling. I don't know if you can imagine looking at your beloved child and saying, I'm supposed to be the one to help you, and I can't. I had 2 amazing behavior analysts who flew out to my very remote place, and they taught me and my family how to do ABA. They provided the supervision. We did the therapy. It was hard. It's not easy, but I only had a high school education. I could do the therapy. I'm not smarter than anybody else in this room, but given that guidance, given that advice, I was able to give my son ABA therapy, and he started to talk. And he called us mom and dad for the first time, and we cried. And then he was able to go to a school and not be in special education. And then he graduated from high school with 16 college credits. And he's now 26. He has a job. He drives a car. He hangs out with people I don't approve of. And he has more money in his savings account than I do. And it's embarrassing because he's a saver. ABA changed his life. ABA changed my family's life so much that I went back to school. I got my master's degree. I did the 1,500 hours of field supervision. I passed the high stakes test to become a behavior analyst because I had seen that change in my own family's life. I had seen what this can do for parents who are empowered. What I want is to give parents the opportunity. We're not forcing anybody to provide therapy to their child. We're not forcing Medicaid. There's not a single kid on Medicaid today that has autism that is going to suddenly have autism tomorrow. This does not change anything. What it changes is it makes it so that I can work with families and I can provide those services to families who are just like me. And I refuse to live in a world where a mom like me who lived remotely, who maybe only has a high school education cannot do the therapy that their children needs, that is not empowered to at least have the opportunity to intervene and to have that chance to make this difference in their child's life. Every family should have this opportunity. And this is a hill I'm willing to die on, because 2 people flew into the middle of nowhere and changed my life. And so this is what I do. You can make me a multi-millionaire tomorrow. I will still be doing this. The money is not why we do this. It's reaching each family, reaching each child, making sure that they have the chance to make this progress for themselves. I know a lot of these other options that have been thrown out are great, fine, but are they going to help your parents tomorrow? Because I can tell you tomorrow, another parent is going to get that phone call from the school saying, hey, little Jimmy stripped down naked and ran across the hall and hit somebody else. And these parents are like, I don't know what to do. As you know, a behavior analyst, when I work with families or RBTs, I make sure they're trained. They get 50, 40 hours of direct training. I make sure that their targets are updated. I give them that concrete feedback in the moment, helping them do the therapy. You can't just watch this on YouTube. And you know, telehealth is great, but I need that trained set of hands on that other side of that camera to actually work with the child. You just can't do it without any training. You do need some training. You do need guidance. You do need to make sure that you have a behavior analyst overseeing it so that the child and the family can do it at high integrity. There is research for parent-led models. The integrity of that treatment is just as high as in a center setting, and the outcomes are actually slightly better because we get the maintenance. Once parents know what to do, they do it and they remember how to do it. So the same things I used to teach my son to ride a bike at 4, I then used to teach him to drive a car at 16.
And Ms. Frome, I really apologize, but we just lost a quorum, so I need to take a quick break according to the rules that say we can't do business without 5 members present. But I just saw 2 of them walk by in the hall, so we're going to take a 30-second recess while I find one of my other committee members. Mr. Michael, if you see Representative Penn in the hall there, you could bring her in. I'd be appreciative. What are they doing? And we're back with the quorum. Go ahead, Ms. Frome. You're doing great. I don't know, you were kind of close, but any wrap-up comments?
When you're talking about dual relationships, and I think that was one of the concerns, we already have these relationships with these parents. And when we're working and doing therapy with families, there are families right now that you work with in the center who don't participate and don't follow through, and you can't continue working with them because it doesn't work that way. And so those same relationships exist, whether it's a parent providing the therapy or just a parent coming in for their parent training. What I am saying is give your parents the chance to be empowered to do this therapy for their own children. When we're talking about the physical costs, there is not a single kid who has autism today that is going to suddenly have autism happen tomorrow through this bill. What this bill does is it says parents can provide the therapy and parents can do the therapy. I did it as a high school graduate. I'm not the smartest goofball on the planet, but if I can pull it off, any parent can. But they need guidance because we as parents don't have these tools. And when my son was self-injurious, I was part of the problem. And my behavior analyst had to put me on a behavior plan because every time he'd hit himself, I would run and say, oh, no, 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 dear, don't do that. And they had to teach me to not give that attention. And that was hard. But without them, I would have never known what not to do. And your parents here in Wyoming don't know what they don't know, and they're struggling every day. Empowering them, giving them these tools is the best thing you can do. I know it's scary, I know it's new, but you never go wrong with giving parents the access and the ability to give treatment for their own children.
Any questions, Ms. Frum? Seeing none. Thank you very much for being here this morning and today to continue the conversation. Other public comment, counseling associations getting up. Welcome.
I don't want
You
to
already provide the committee handouts?
Mr. Chairman, I do have handouts, but I don't want to double possibly what's already been given to you. So if you recognize this, let me know. If you don't recognize this,
We did get an email this morning, so.
perfect.
So with that, go ahead, Mr. Semino.
Mr. Chairman, Lindsay Simoneau with the Wyoming Counseling Association. I will do my darndest to be brief and also skip things that may have been covered. The Wyoming Counseling Association is opposed to this bill because of the ethical concerns that are addressed. The National Behavioral Analysis Certification Board, which is the handout that I asked if you recognized, they address 6 different ethical concerns when it comes to multiple relationships. These aren't fears. When it comes to our ethics, our standards, doing no harm is foundational to our profession. Therefore, our ethics really do guide us on a day-to-day basis to make sure that we are not causing harm. There has been a lot of discussion about the multiple relationships between the parent and the child. What hasn't really been highlighted is the multiple relationships that would then exist between the parent and their clinical supervisor. What we would then have is a parent who is providing services for their child, but has hired the provider to be the one overseeing the treatment for their child, but then also giving them clinical supervision for their technician registration. Does that make sense? I'm looking at our
Say it
dear
one more
Mr. Chairman.
time. I mean, I think I get it, but just repeat that.
Correct. So what we would have is a parent who has hired a board-certified behavioral analysis to render services and treatment for their child, develop that treatment plan, but then that provider would also then be supervising the parent. That is also unethical because that is also a multiple relationship. That puts the parent at risk. Therefore, we're not just worried about the child, we are worried about desperate families, desperate parents that are wanting to get help. Now, as what was emphasized this morning that I would love to reemphasize for the committee, yes, there is structure in place where parents can get this training, can become behavioral technicians, and they can then engage in those techniques with their children. They cannot bill their own insurance for that. That is the part where it becomes unethical because we've introduced money into the situation. And we all know that money makes things complicated. I, as a licensed professional counselor, will take advantage of my expertise with my kiddos, but I do not bill my Blue Cross Blue Shield policy for that. That is just me taking advantage of the information that I have to be a good mom. We appreciate that these parents want to have that information. We are excited to pursue possible solutions for them to gain that information so they can have that training to help their children. What we are asking for is to do it in ethical ways that don't compromise the different relationships that are involved here. With that, I stand for question. I do also want to emphasize, I forgot, we are more than willing to bring this into the interim and come up with a friendly bill where all stakeholders are involved. I think that that's when we have the best moments, the best bills. We were able to do that in 2022 when we brought ABA certification to the Psychological Licensing Board. We would be more than happy to meet in the interim and figure out another possible solution for these parents that are wanting to pursue this again. And we look forward to that discussion. And with that, I stand for question.
Questions, Representative Penn.
Thank you, Mr. Chairman. You mentioned doing no harm, which would then correlate with your thoughts on this causing harm. How, outside of just the ethics, how would you see this as being harmful to a child?
Mr. Chairman, Representative Penn, we will apologize to my oldest son later. I have 2 children. I am their mom. I have to discipline them. I have to make sure that they are not causing shenanigans, that they are not running amok. That is my job. And I love that job. They are great kids. It makes it harder for me to go from a mom to then engage with them in a therapeutic relationship where I am providing services. Now, I recognize that the relationship between the technician and the child is different. However, that parental relationship of mom or of parent is still the same. It does compromise, whether we realize it or not, whether we acknowledge our biases or not. It does compromise what we as parents are able to do, see, or address, which is why that's not billable. There have been times where my kiddo has needed something mental health wise that I completely missed because I had my mom glasses on. So that outside perspective, having that third party that is objective is incredibly important when it comes to our ethics.
Thank you, Mr. Chairman. Do you see that there's a need for this in our state? Earlier today, we heard that there's a one child to 30, or other way around, one therapist to 35 child ratio. So it seems to me like we have this need. You mentioned that parents can get registered already, but it seems like they haven't been. And so I guess my question is, how do we fix that? And why haven't we already done it if we already have the tools available without this?
Ms. Semino, if you want to wade in.
Mr. Chairman, Representative Penn, I think the reason it hasn't happened is because of the newness of our certifications for ABA. They did just go live in 2022, and as you heard earlier, our first ABA certification happened in March of 2023. That's not even 12 months. And so I think for a lot of parents that testified, them not having ABA access before 2022 is completely true because those certifications didn't exist. Now that they do exist, now that that is accessible, I think part of it is a knowledge issue that they don't know that they could receive that training. And as was testified earlier, there are other solutions to where we can make that more known to the public, as well as offer additional trainings and see if there's other. Trying to figure out a way to say this. The WHIP initiative was something that came up as far as, is this something that we could come up with an innovative way to make sure that this training is rolled out to parents who are interested? There are other ways that we can do this, that we believe that we could do this without violating different ethical codes.
Yeah. Other questions? Seeing none. Thank you, Mr. No.
Thank you, Mr. Chairman.
Just wouldn't be a day in labor health without you being followed by Ms. Somerville, but maybe Blue Cross is going to come up first. Or maybe WAMSAC's going to, you can sit at the table too. Okay. Welcome, Rocky and Heather. Introduce yourself, floor is yours.
Morning, Mr. Chairman, representatives. My name is Raymond Redd. I'm the General Counsel for Blue Cross Blue Shield of Wyoming. And Blue Cross Blue Shield of Wyoming has been in this committee several times to testify, but I think I'll just mention that Blue Cross Blue Shield of Wyoming is the only health insurance company that is domiciled exclusively in the state of Wyoming. We have around 300 employees, but we're actually one of the smallest health insurance companies in the country when you look at it from a national perspective, which makes us unique. But we're not unique to Wyoming. We understand Wyoming, and we also understand the epidemic that exists with respect to autism. We understand as a company that it's important to provide coverage for these services. In fact, we're mandated to do so with the products that we offer. ABA coverage is mandated in Wyoming and nationally through mental health parity, and our state has also required us to cover it. We have approximately 1,000 members, give or take, that have autism, and we provide coverage to those members, and we also provide millions of dollars in coverage to those families whose children or family members have autism. And what I will say is it's really not about the money that we're providing. We really do feel like it's important to provide this service. And I do think the newness of the legislation that exists makes it hard to sort of predict what will happen in the future. What I will say, and what I've sent to members of the committee, are some of the concerns that Blue Cross Blue Shield of Wyoming has with the model that Forta is presenting. And I would say the first and foremost concern that we have in the crux of the situation is that the BACB, which has been referred to today, the licensing board that provides the certification for the BTs, has specifically said that parents should not be in this role. And specifically in the delivery system, meaning a supervisor above them where they're acting as the BT for their child. And many folks have testified to that today. And I won't pretend to be an expert because I'm not a licensed provider. But what I will say is the ethical concerns I do think can cause harm in a myriad of ways, and they're hard to predict. But I think what I would say is when there's money involved, when there's services involved, when there's family members involved, you can just never be too sure with that provider-client relationship how the dynamic might change. And so that's the concern that we have. And I think, Forta mentioned that this has nothing to do with insurance or Medicaid. They might not have said insurance, but they did say Medicaid. But what I provided to you as a handout is the FAQs from the Forta website. And the first eligibility requirement that they provided in order to be eligible for this program is that your child has an active insurance plan. If the child does not have an active insurance plan, Forta does not provide this service. They will not allow the parent to get certified. At least, and I could be wrong, but I'm just going from the FAQs that I'm providing to you all today. So, and the other thing that I've been able to distill from this information is that when a parent becomes a BT under the Forta model, they can't provide services to any other person. It's only their child. So they're sort of locked in to only providing that to their own child, even though they've received that BT service. So from my perspective, I think the question I would ask is, should Forta be working with the BACB to take their policy stance, which is that parents and family members should never be doing this? That's what the BACB says. That's what the licensing board says. They should never be doing this. Should Forta go to the BACB and say, let's have a discussion and change the policy as the licensing board, that you will buy into this, that you will believe in this, that you will listen to the parents, family members, children with autism, and change your policy? Because now what we're considering doing is creating a policy in Wyoming that would be against the ethical code of the very board that certifies these individuals. So that's our main concern. And while it's been mentioned that insurance is not a part of this bill, I think it's clear when you look at the Forta FAQs that insurance is paramount to their model. And another concern we have is that, at least from the FAQs that I've gone through and shared with you all today, that Forta also collects deductibles and co-insurances from the family members who are BTs. And it's not specific. I mean, as you can see here, they say that it might be reviewed or discussed whether co-insurance will be taken. But if they don't have insurance, what is true is that they do not accept out-of-pocket payments. So from my perspective, this model only works if insurance is involved. So while Forta is saying, we'll fight that fight later, I think that was the term that was used, that is their business model, is for insurance to be involved in this. So from my perspective, if that's the model, then we're already talking about insurance being involved here. And what I would say is, with respect to a fiscal impact, we don't have numbers for you all today, but it'd be very, very similar to what Medicaid shared with you all today from the perspective of a health carrier, and that cost being spread out to the rest of our members. So that's my comments for now. I'm happy to answer any questions. And I think the other thing that was asked earlier was about the state laws. And this is also on Forta's website under eligibility. You can't currently reside outside the states of Nevada and South Dakota. So I provided you with two statutes in South Dakota and Nevada where this type of model is prohibited. I'm happy to reference those statutes, but I would say FORTA is aware of this, right? They're aware of this because it's on their own website. They know that they can't do this in those states. And I have provided you with the statute references, but I can provide you with the specific statute references if you'd like, where family members are specifically prohibited from providing the service. Thank you. We stand for questions.
Do you have additional comments, Mr. O'Day, for questions? Let me ask one first, and I should have asked this morning, and you might not know. Is FORTA the only company in this space right now who's offering this type of endeavor? I can certainly call them up and ask, but I mean, if
Mr.
they are, it's
Chairman.
one thing. If they're not, and this is
Yeah.
broader than one company, I don't know if you know, but I thought I'd check
Mr.
with
Chairman,
you.
I don't think I can respond to that
Okay.
with any intelligible response. But what I can say is that based on their business model and based on my understanding of it from their FAQs, what they are doing is they're saying, if you do become a BT under our model, you're locked in. You will be working for us and you will be providing these services through us. So therefore, it's not transferable. We're talking about providing more BTs for the community, allowing this process to increase. But what we're talking about here is locking them into FORTA's business model. So even if another similar model existed, their certification, at least from what I can tell from this FAQ, would not be transferable to, say, another private company for profit.
Representative Penn, you have a question?
Yes, thank you, Mr. Chairman. Can you tell me how the payment actually works? What do you pay? What do you reimburse for this? And is that like a monthly thing? Because this would be not a one-time service. This is probably an ongoing thing. And so what are you paying out for these types of services?
If you know.
Mr. Chairman, Representative Penn, we do have a printout of some of the costs that are associated with this. As I mentioned, we have nearly 1,000 of our members who have this diagnosis. And we do have several statistics data with respect to the amount that we've paid on this. And as I mentioned, it's, close to the amount of $3 million in 1 year that we might pay for a service like this. But again, we were scrambling to come up with this data. So this data may need to be refined. I just want to put a pin in that for that. But in looking at it, the claims are all over, because I think, as someone mentioned, and I think it was Medicaid, in fact, ABA is not the only service that somebody with autism can receive. I mean, I understand how it's been sort of talked about today and how important it is, but there are a myriad of other services that a child with autism can receive besides ABA. So it's not the only service. So we haven't broken it down as specific as Medicaid has this is the cost for ABA services, but we can see, through the report that we have here and the data that we have, that we are paying for this, and we are obviously wanting children to receive this. So I don't know if that answers your question, Representative Penn, but I can clarify if you need me to.
All right, we're a little short on time. Thank you much. If nobody has a question, any other public comment? You do, Ms. Somerville. We can make it kind of quick because we got 15 minutes to be back on the floor, and today's the last day of bills. Go ahead, Andy.
Thank you, Mr. Chairman. Andy Somerville, Executive Director for the Wyoming Association of Mental Health and Substance Abuse Centers. And you are correct, Mr. Chairman, I like to visit you guys every day. So the perspective that WAMSAC wants to bring is a perspective of making sure that these children in this spectrum receive their services. They often have co-occurring mental health disorders. They often have what I would phrase as care teams, a variety of providers that are working with them. They can be psychologists, they can be behavioral analysts, OT, et cetera. And it's certainly not new information, and it's been discussed today that we have a shortage in a variety of healthcare professions across the state of Wyoming. And in fact, this committee has probably seen me more often than they would like as I'm talking about workforce and how in the world we're going to find more people to do the work, especially in the behavioral healthcare space. I have spent quite a bit of time in the last week trying to figure out whether this works, whether it's something we can implement in Wyoming. What are the concerns from my providers? They expressed some of the similar concerns about ethical rules. It's a payment model for this private company that's never been seen before. And so everybody's, I think, a little uncomfortable with it. And maybe that's a knowledge and a time thing. Maybe it's something else. That certainly deserves further discussion. But what we are here to do is find solutions, and we want to absolutely be part of those solutions. There's a couple of things in terms of the numbers of children with autism. Those children are going to need a range of services. The spectrum is varied considerably, and services need to be tailored. So all of those children, we would not expect to need ABA services, but quite a few of them will. When we brought the licensure bill 2 years ago, it was because we were told there was a definitive need from the state and from the communities, and we needed to do that. I think we had hoped that the program would have some time to grow. Within the first year, I think we only had 7 or 8. We're now up to, I think she said 47 or 48, so we're getting there. But there's certainly some things that lack in Wyoming in terms of training. You can't underestimate the importance of the parental role when dealing with autistic kids. And it is clear to me from listening to the parent testimony and other conversations with providers that the parents absolutely play a critical role in making sure that these children receive services. And kind of think of it as a three-legged stool. You've got, whether the child is in preschool or is in K-12, you've got school-based supports, you've got parent and home supports, and you've got clinical supports. And what we want to make sure is that those kids get all of those supports. So I certainly support the idea of trying to get something in the governor's WHIP initiative. I think that is certainly something that's possible. It is clear to me that we need to work with stakeholders to provide some parent training. There is nothing that is a consistently used practice right now in terms of parents receiving training and working with their children at home. There's nothing in the state licensing or statute that prohibits that model right now in terms of them fulfilling that role. In fact, it is encouraged. What is concerning to me, and I have shared this with FORTA and tried to find a way around it, is that I think that we're just a little bit, we have to look at the licensing statute first. So in my opinion and assessment, the licensing statute that was passed will have to be reopened first. It is clear by the rules in the statute that BCBA, as what's described, is the controlling entity for these licensures. I've had conversations with them. They've been very clear that they think that this is, in their estimation, an ethical violation. It is a reason to remove a behavioral analyst or an ABA's credentials, which then, as we are set up right now, would require the state of Wyoming, the board, to potentially remove that license from that behavioral analyst. That concerns us from a professional integrity standpoint. We never want to put a behavior analyst or any other licensed professional that is doing a good job in providing services in the state of Wyoming at risk. And I'd be happy to provide the committee with any of the rules and regulations and carve-outs if you want them that clearly define this as being an issue. What we are recommending is that we will certainly put our name behind trying to figure out some training in the meantime and some better connections for parents as we move along. But we would recommend that we take this to the interim to have a further discussion and potentially look at opening up the Licensing Act. And then finally, I would just remind this committee, this is not the first time that we've had potentially a licensing issue. A few years ago, for those that were on the Labor Health Committee, we dealt with this with the addictions providers. We had come to a crossroads where the national agency, NADAC, at the time had standards that just did not work in Wyoming, and it was creating a problem in being able to provide those services. We worked that process. We put a group of stakeholders together, brought a bill that corrected that, got that passed by the legislature, and we've had no problems since. So my heart aches I want to get these kids services right away. But the professional side of me says we need to take this through the right process, and there is a process to correct this. So, Mr. Chairman, I'd be happy to stand for any questions.
Questions for WAMSAC? Representative Penn.
Thank you, Mr. Chairman. So let me make sure I understand. So you're saying that this BACB, if we were to enact this, the BACB would pull the certifications of the behavioral analysts that we currently have?
Mr. Chairman, Representative Penn, let me just clarify. If they were to find out that a behavior analyst who holds one of their credentials licensed in Wyoming was engaged in one of these relationships where they were supervising and involved with this type of model, then they would pull their credential from BCBA, which we require for them to hold Wyoming licensure. They're the only credentialing agency. In fact, it's spelled out in the board rules. They are the only credentialing agency for a behavioral analyst right now in the state. If they lost that credential, then they wouldn't be eligible for licensure in Wyoming. And Mr. Chairman, if I can just
Yep.
expand a little bit,
Quickly,
we had a
quickly.
very similar problem with the addictions providers where we had that one national agency that we had used forever became problematic. What we did is we looked and found an alternative and laid down an alternative pathway so you could have one or the other to be credentialed, that the board felt comfortable moving forward, that somebody was certified and competent and could provide that service.
Further questions? Seeing none. Any other public comment? Mr. Michael?
Chairman, we did change flight plans. Burning questions available for them to answer those. We want you to work with those.
Thanks. Anybody have any questions for anybody in the audience? Anything they may have heard? Representative Yen?
Mr. Chairman, could I bring up Ms. Reed?
Sure. Ms. Reed, this'll,
I know she's not an expert, but it is a question of, I mean, basically, Mr. Chairman, I'd like to ask you, is that situation where if the certification board stripped them of their certification, would the Board of Psychology have to strip the license from the behavioral analyst?
Ms. Reed, if you know.
Mr. Chairman, Representative Yen, I can't answer that because it would be the board's decision. The board, if a complaint was filed, since we have not had a complaint like this yet, and I hope that we do not, but if one were to come to us from the BACB alerting us to the fact of an individual that is licensed in Wyoming has lost their credentials through the BACB, a complaint would be filed. The board would investigate. And they work very closely with the assigned attorney from the Attorney General's office. So that would be the determining factor as to whether or not they would have to, the way that the statute is written and the way that the rules are written, it appears to me that they would need to revoke the license, but I don't make those decisions, so I can't.
Okay. Any other questions for Ms. Reed? Yep. Or anyone else?
I do have one more question for Mr. Thacker, if he's willing to come back.
Okay. Thank you, Ms. Reed. Ms. Thacker, come on down. Representative Yen.
Mr. Chairman, thank you. I do appreciate you making the time. I think I signed on to this bill because I believe that, for a lot of reasons, I believe that we need more care in Wyoming. That I want to make sure that it is feasible and that we're not actually going to get behavioral analysts having their license revoked, because I think that does the opposite goal of what any of us want, right? So I'm trying to understand, we had someone who is using the Florida model already in Connecticut, I think is what she said. How is that working in Connecticut, and has there been any issue with the licensure board there?
Yeah, so, sorry, thank you. I'm going to try to keep it short because I know we're short on time. We are in other states. We're working. We have about 50 BCBA behavioral 30 behavioral analysts in our company right now. They're doing this because they really believe in this. There's a shortage, there's a crisis, there's a need. We've talked about all these other things, but we haven't talked about solutions other than training, which we wholeheartedly agree. So these behavioral analysts are doing this because we believe that we are on the right side of providing some care is better than no care. And that's the goal. So yes, if the BACB was a nonprofit in Colorado, is making determinations on licensing boards across the country, that's managed by a board of directors of 5 managers or 7 managers that are self-elected. That's where the concern comes in. Is how do you kind of self-regulate Wyoming with you as a state putting your licensures and determining how to do it, versus saying we can't do this because there's a nonprofit somewhere that's going to make the rules for us, which is what ends up kind of being pushed around. So I'm going to try to be quick. Our analysts they're there, they're believing in it. We're in the States, we're going at it. We haven't had like consistent reach outs. We haven't had anything that's from any licensing board that's kind of like in this world right now. So I'll leave it at that.
Other questions? Seeing none, thank you for coming back up. We'll close public comment committee. What is your pleasure on House Bill 143? I'll ask you a second time. Anybody have any motions on 143? Going once, going twice. Okay. No motion on 143, but I have a strong feeling it'll be an interim topic. If that works. It's rare for, to come in with some of the just unknowns. So Representative Chairman Olson, certainly appreciate your time and look forward to working with you in interim. I've been there over the years and it's just, takes a little more time to work some of these things. So for that committee, third reading of the budget, and we'll see you Friday.